We talked the ear. In the ear, we completed outer ear, middle ear, and inner ear. So next, after that, we will talk about cochlea. So basically, this is the cochlea. Okay. So we will talk in detail their related things. The cochlea is shaped like snail shell with 2.5 structural turns. Internally, the cochlea is partitioned into three filled canals. The medial canal is the cochlear duct, the floor of which is basilar membrane that support the receptors for hearing in the organ of corti spiral organ. Receptors are called hair cells. Their projections are not hair of course, but rather are specialized microvilli called cetri- cetrocoli, cetrocili, which contain endings of the cochlear branch of the cranial nerve, overhanging the hair cells in the tectorial membrane. So basically, you can see that this is the cochlea. Cochlea is turnings. You can see that this is the turning. Okay, so this is the turning. Okay, this is the turning. Okay, so in there we have cochlear duct. This is the cochlear duct. This is the uh, tunnel type like structure. This is called scala tympani, and this is scala vestibuli. So cochlea, the sounds will travel. Okay, and it will connect it to the cochlear nerve and vestibular nerve. So vestibular nerve, you can see that this is the branches. It is connected. Okay, and we have cochlear nerve also. Cochlear nerve. Okay, so cochlear nerve is connected to the cochlea. Okay, next, well, how the process is happening. And again, you can see that in the cochlea we have hair cells. You can see this is the hair cells. This is the basilar membrane. Okay, you can see this is the cochlea. If you can see this is the hair cells. Okay, hair cells are present. So what is the function of the hair cell? So basically they are receptors. The hair cells are receptors. Whatever whatever information of hearing we will hear, that is gathered by the hair cell. Okay, then only it will transfer to the cochlear nerve. Okay, so we have the cochlear nerve, eight cochlear nerve. So how the process of hearing occurs? Let's see that. So basically what will happen? So the transmission of vibrations and the generation of nerve impulses, sound waves enter the ear canal. Vibrations are transmitted by the following sequence. Eardrum. So basically whenever the sound waves enter into our ear canal. So yesterday also I explained. Okay, again here is giving an sequence. Okay, so first it will enter into the eardrum. This is the eardrum. Okay, this is the eardrum. Will connect the sound waves connected. Next, from that malleus incus stapes, there are the three bones connected to each other. Okay, small bones. Okay, so they are the oval window of the inner ear and perilymph and endolymph within the cochlea. So this is the cochlea. So then it will reaches to the cochlea. Okay, cochlea have, you can see that here we have number of things are connected to the cochlea. Okay, so you can see here, yeah, it is very detailed. This is the atrial sacculi. Okay, so here we have the eight cranial nerve is entering. Okay, so this is the ampulla. Okay, this is the hair cells. Okay, so whenever so this is all about balancing equilibrium. Okay, so we'll talk about later. So basically you can see that this is the endolymph. Okay, So basically, it will connect it to the we have perilymph and endolymph in the cochlea. So in the cochlea we have endolymph and perilymph. So imagine the vibration in the fluid are ripples or waves. The basilar membrane ripples and pushes the hair cell of the organ of Corti against the tectorial membrane. When the hair cell bend, they generate impulse and carried by the eighth cranial nerve. So what will happen? So here you can see that image. So basically, if the wave is coming into the cochlea, so basically we have basilar membrane. So in the basilar membrane, we have connected that what we connected hair lines, hair cells. So here on the hair cells, it is connected to the these hair cells are connected to the this is the eighth cranial nerve. Here is going on. So what will happen? The sound waves are coming, okay, inside this or from that area. Basically, it is touching to the hair lines. So hair lines will like they will waves, okay, the waves. So the hair lines will touch to the nerve fibers, and because these are the receptors, so it will generate the impulse. What will do? No? They will generate the impulse. Okay. So what will happen next? So general the impulse. So it will connect it to the auditory of the temporal lobes. So we have temporal lobe in that area. We have auditory area. So the eighth radial nerve from that ear. Okay. So from that ear. So basically that ear is connected to the hearing area that is present in the temporal lobe. Already we talked about. It is that the sounds are heard and interrupted. So basically, whenever any damage occurs to the eighth cranial nerve or visual cortex area, sorry, temporal lobe area or auditory area, what will happen? The patient will complain hearing loss, okay, or interrupted hearing, or he cannot hear from one ear, he is able to hear from another ear, okay. So these are the things we can see in our general practice. The auditory area also enabled us to determine from which direction sound is coming. So simply stated, the auditory area count and compare the number of impulses coming from each ear. For example, if more pulse arrive from the left cochlea, then from the right one, the sound will be projected to the left. If the source of sound is directly above your head, the sound may seem to come from all directions because each auditory area is receiving approximately the same number of impulses and cannot project the sensation to one side or another. So how you can calculate that the sound is coming from the right side. So what will happen? The more number of impulses will reach to your right ear, right cochlea. So the ear, the sound is coming from left side. So the more number of impulses it will reach to the left ear in cochlea. So then the auditory hearing area, okay, hearing area will determine that this sound is coming from left side or this sound is coming from right side. Okay, so this is how we can determine how from which area the sound is coming. Another example is was giving here. If the sound is coming from above the head, if same number of impulses are reaching to the cochlea, so what will happen? So the cochlea will decide that the same impulse is coming, so the we can determine that the sound is coming from above. Okay, this is how we can sense the sound and also the direction of the sound. The final structure in the hearing pathway is a round window. The membrane covered round window, thus below the oval window, is important to relieve pressure. When the step pushes in the fluid at the oval window, the round window bulges out, which prevents damage to the hair. So basically here we have the round window. You can see here. So what will happen if the hairs are coming and touching to the eight cranial nerves? Okay, what will happen? It may be it will produce the pressure. So the waves are coming, sound waves are coming, and touching to the hairline, and hairline is touching to the eighth cranial nerve. Okay, So what will happen? So it will produce some pressure. So we have to release the pressure. So it will, the pressure is released by this oval window. So this is the window. From that area, the this is the round window, you can see that. Okay, from that area we will release the pressure. Okay, so this is the god gifted thing which is maintained by our body. So this is how we hear. Okay, this is how we hear. So basically what will happen in the deafness, what will happen? It may be the defect of conducting system. It may be defect of cochlea. It may be defect of any. You can see that this is the malleus, incus stapes, or any canal, vestibular branch, anything, cochlea or tympanic membrane. So any damage in this conducting area will lose the hearing capacity. Okay. Next, it may be due to the eighth cranial nerve damage. Okay, or central deafness, or the auditory area which are present in the temporal lobe. It is, if it is damaged, then also the patient is unable to hear. So it may be the conducting system deafness, or nerve damage, or central area damage will cause deafness to the patient. So some patients, you can see that the baby is born but he is unable to hear. So it is congenital defect, by birth defect. Okay, after sometimes the patient come into hospital, here I am hit to the ball, or ball hit to me. What will happen after that? I am unable to hear from this ear. What will happen? The central definition is seen. The patient is telling that I am skid and fall from the bike. Then I have injury to this area, or this area, this area. So what will he tell? You can see that nerve deafness, nerve is damaged. The patient having having the, always he will put one pen, or he will always clean his ear. So it is damaged, some sort of eardrum. So it is conducting deafness. So different types of deafness or we see. Okay, next we have atrial and sacral. This will be very very important, because uh it will, what will, you can see that this is a very important thing during to maintain the pressure equilibrium. So we have atrial and sacral. Our membrane sac are called vestibuli. So you can see that this is the vestibuli. Here we have the vestibuli. Okay, so you can see that this is the vestibuli. This area is vestibuli. In the vestibuli, we have two things. One is atrial and sacral. So between the cochlea, so you know where is the vestibuli situated? Okay, within the atrial and sacral are hair cells embedded in a granulaceous membrane with tiny crystals of calcium carbonate called otoliths. Gravity pushed the otoliths and bent the hair cells as the position of head changes. The impulses generated by these hair cells are carried by the vestibular portion of the eighth cranial nerve to the cerebellum, the midbrain, and the temporal lobes of the cerebrum. So what will happen? How the equilibrium is maintaining? Kindly see. So what will happen? So you have, if things, you have the, this is the this is the vestibuli. In the vestibuli, atrial and sacral. Okay. In the vertebrae and sacral, there is a membrane which is made up of calcium carbonate called otoliths. Otoliths. This is the membrane. This is the membrane. This membrane is connected to the hair cells. Hair cells are there. Okay. So what will happen whenever you change the position, or you change the head position? So what will happen? Whatever impulse are generated, so these hair cells will take and it will give to the cranial nerve, and eight cranial nerve from the eight cranial nerve to the cerebellum, the midbrain, and the temporal bone of cerebrum. So temporal bone of cerebrum, it is related to the hearing. Cerebellum and midbrain is related to the equilibrium. Okay, so this is the very important thing you have to remember. Vestibuli. What is the work of vestibuli? In the vestibuli, we have arterial and saccular. In that, we have the membrane, oolitis, which is made up of calcium carbonate. In that, we have hair cells. Eight cells is connected to the eighth cranial nerve. So this nerve is taken to the cerebellum, midbrain, and cerebrum. So cerebrum, we know that eighth cranial nerve for hearing, in the temporal lobe, cerebellum and midbrain for equilibrium. Okay. So the cerebellum and the midbrain use the information to maintain equilibrium at the subconscious level. So whenever you move, you walk, you travel, anything, so subconsciously is maintaining the equilibrium. Okay, we can of course be aware of position of the head, and it is cerebrum that provides awareness. But sometimes we aware the position of the head, but we cannot aware the equilibrium is maintaining. Always we are in same position. If we move the head, if doesn't we doesn't move the head. So always we are in same position. Okay. So this is all about how the equilibrium is maintaining. How we are when we are walking. Okay, when you're turning, suddenly you are not falling. Okay, this is how the equilibrium is done. Next, we have semicircular canals. The three semicircular canals are full-filled membrane ovals oriented in three different planes. At the base of each enlarged portion called the ampulla, which contains hair cells. Again, we have ampulla. You can see that this is the ampulla. This is the ampulla. Okay. Already we talked about arteria, crista, sacculi, vestibula. Okay. Now we'll talk about ampulla. So ampulla have three membranes, three semicircular canals. Okay, sorry, not membranes, semicircular canals, which contains hair cell. Again, in this have hair cell we have. Okay, that are affected by movement. As the body moves forward, for example, the hair cells are bent backward at first and then straight. The bending of hair cells generate impulse carried by the vestibular branch of the eight cranial nerve to the cerebellum, midbrain, and temporal lobes of the cerebrum. These impulses are interpreted as starting or stopping and accelerating or decelerating or changing direction. And this information used to maintain equilibrium while we are moving. So basically, when we are moving, semicircular canals, semicircular canals. So these are maintaining the equilibrium when you are moving. Okay, so what will happen? The when you are when when we are whenever you are bent backward or forward, whatever things you will done, so what will happen? So these canals will help you to maintain equilibrium. Okay. So next, so these are the things which maintain equilibrium in our ear by the help of ear. Next, we have arterial receptor. The aorta and carotid arteries contains receptor that detect changes in the blood. The aortic arc, which receives blood pumped by the left ventricle of the heart, curves over the top of the heart. The left and right carotid arteries are branch of the aortic arc that take blood through the neck of the way on the way to the brain, in which in each of these vessels are pressure receptors and chemoreceptors. Pressure receptors in the carotid sinus and aortic detect changes in blood pressure. Chemoreceptors in the carotid bodies and the aortic body detect change in the oxygen and carbon dioxide content and the pH of blood. The impulse generated by these receptors do not give rise to sensation that we feel, but rather are information used to make any sensory changes in respiration or circulation. We will return to in the later chapters. So what will happen? So why this is explaining here? Because whenever you travel, so it may be uh, traveling maybe in the bike, bus, or high altitude area. So whenever the oxygen levels decreases, so this aortic receptors, so in that the BP may be decreased, the BP may be raised. So it will detect. The chemoreceptor will detect the decrease of oxygen levels and increase of carbon dioxide levels. So it is very helpful. Okay. So it will detect the changes which are present in this condition. So later in the cardiovascular system, we will talk in detail about this. Okay. So another one condition is explained, that is motion sickness. Motion sickness is characterized by cold sweats, hyperventilation, nausea, vomiting. When the person is exposed to repetitive motion that is unexpected or unfamiliar or that cannot be controlled, sickness is a type of motion sickness as a carry sickness. Some people are simply not affected by the rolling of ship or train. Or others, the constant stimulation of the receptor for position first become uncomfortable, then nauseating. Those who know they are susceptible to motion sickness, medications are available for us before traveling by plane, train, boat, or car. So basically, motion sickness is due to the uh, movement of receptors. So receptors will move gradually. So that's the reason the patient may feel vomiting, nausea, or sweating. So we have to use medications for that. So because their receptors are very sensitive. Okay, so that's the reason it is happening. All this sense may be damaged in old age. Basically, we know that gradually the receptors will decrease, and we have the decreased capacity of hearing. Okay, so gradually the hair cells and everything will decrease after the age of certain age of 60. Okay, so that's the reason the older people will listen the voice very. They need loud voice to listen the sound. So I think we completed the topic sense. So we have the questions here. We have to answer the all the 9 questions. Okay. Then next chapter is endocrine system, which we will start tomorrow.